So hello and welcome to another segment of Elder Abuse Awareness Virtual Coalition. My name is Elisa Gwilliam, and today I have the pleasure to talk to Professor of Psychology and Director of the Center of Aging and Disability Policy at Mount St. Mary College, Dr. Larry Force, the Director of Orange County Office of the Aging, Anne-Marie Maglione, and our special guest today, Orange County Executive Steve Neuhaus and Health Commissioner Dr. Irina Gelman. So welcome. Today we're going to be talking about government's response to COVID-19, leadership and beyond. And I'm really glad all of you can be here. These have been really interesting times for everybody on personal and professional levels. And Dr. Force, why don't you kick us off?
Okay, well, thank you, Elisa. And County Executive Neuhaus and Dr. Gelman, thank you so much for joining us today. What started off as an informal discussion, we have all this content knowledge about elder abuse, and we have a track record of participating in conferences. One conference we hosted at the college, we had 500 people 2 years ago. But those days are different now, and we knew immediately that we had to figure out how to pivot and how to be present and add support for families. We have all this content knowledge, but we're not in a position to assemble people. So in speaking with Anne-Marie Maglione and Tim Murphy, we said, I'm using this platform prototype in a different project and getting good feedback. I said, why not try this same type of platform where we meet and our strength is in our distribution, through our email distribution and our collaborating agencies. So we brought Alyssa into the discussion and another friend and colleague, Dr. Jerry Abatiello. And from the point of discussion to the point that we had our first, video cast was 12 days. That's how quick we were able to ignite this. And we've received tremendous positive feedback, not only within the county, but within the state. Anne-Marie has tremendous connections through the New York State Office for Aging. We have one of the guests that we had on here was Greg Olson, who's the director of New York State Office for Aging. He asked Anne-Marie to send this model out through all the AAAs throughout the state. Next thing you know, we're getting correspondence from national organizations, even asking us to present at their virtual conference about this model. So this is a real tribute to you, Steve, for sure, because of your leadership in this. But at this point, I'd like to ask Anne-Marie if she would introduce you.
Yeah, I'd be delighted to. Thank you. As Dr. Force was saying, this really became a grassroots thing. COVID, as Dr. Gelman and County Exec are going to talk about, we went from 0 to 60 and we took it seriously and we did everything that we needed to do. We're doing all kinds of virtual meetings, and the one thing that we really needed to focus on was elder abuse. The worst thing that you can do is isolate a senior because they're going to be a prime target. There's 26 million Americans that are unemployed, but older adults get their Social Security check the first of every month. So this has been an issue. We really created this to address the need, and it has been such a thirst that people are loving it. And one thing that we felt that we really needed to do was to bring our leaders on, which is our county executive and our health commissioner, Dr. Gelman. So it is my great pleasure to introduce our county executive, Steve Neuhaus. Steve, are you there?
In. Probably just have to unmute. Yeah, unmute.
I'm here, and this is the craziest time right now in our lifetimes, and we do see people not only need food, but like you said, they're lonely, they're home alone. There are a very large increase in scams. So this is a very critical time, I think, for senior citizens, an important role for not only government officials and caretakers, but the common public needs to be aware of what's going on out there and needs to know what they can do to help these individuals, whether it be volunteering, Like we've seen, the food banks have been taxed to the limit on the amount of people that need food. You have a lot of people that are in the public that are seeing abuses. They've been reporting them. There's a number of places you can do it. You can do it confidentially through a district attorney. You can do it through our office. And then lastly, we've also been having a hard time trying to make sure that we have the volunteers to go to the houses. So a lot of different organizations have stepped up. So we have that continuity. And we also have people that are actually checking on people. And we just had a case in the last few days where people from your staff, Anne-Marie, partnering with some of our volunteers, helped save somebody's life that was, in need of help for, I think, over 2 days.
Mm-hmm. Yeah. Yeah, and that's a form of abuse is self-neglect. So, if you don't have anybody that has the eyes and the ears on them, that can easily happen. So yeah, that's a really good point. And Steve, you also have so many services in place: loneliness, isolation, anxiety, depression, and WOGI is out there for them, which is the Welcome Orange Geriatric Initiative. So if you have any kind of mental health issues, where we have services in place that you just can call. All of these things, if you need to reach us, please call our New York Connects line, which is our single point of entry. It's 845-615-3710.
And I think the one thing that we wanted to make sure that people were aware of is the fact that we're open for business. And when I say we, for sure, your county is open for business. Yes, we're operating from remote locations, but people do not have to do this alone. And one of the things that we clearly see is that this is an intersection between an epidemic of elder abuse and a pandemic. And how we're going to do business and how is going to be different. And the feedback that we're getting from individuals and agencies is the fact that they really do like the content that we're getting out there, but also the resources and supports. And look, Steve, I'm really glad you're able to join us today. I mean, this is a little infomercial, but I need to say this, that we are so proud of you because you're one of our students. You graduated from the Mount, and here we are years later. You've taken such a strong leadership position in the county. So we're very proud of the things that you've accomplished and how.
And I'm proud to be a Mount grad, and I learned a lot there. I have lifelong friends from there still, and I'm glad to keep that connection, obviously, with you, Dr. Force, and the rest of the faculty, and even some of the students. So I appreciate the accolades, and it's a team effort. And again, I'm proud of my education I received at Mount St. Mary. It helped mold me to where I am today.
You clearly did us well. Dr. Gelman, you come to the table as an expert, as not only an expert, but somebody that has a lot of seasoned experience. So in your early training, did you ever think that you would be addressing something like this?
Definitely not something of this scope and magnitude. And I will say that this particular pandemic globally affected the older adults disproportionately so. And now we're truly reeling from a number of both social and medical issues that seniors are faced with at this point. We're thankfully on a downward trajectory, so hopefully those numbers will continue. And as we're really assessing a lot of the impact, partially what we were discussing here, even the platform we're utilizing right now, it is the perfect medium for disseminating information. But when it comes to older adults, that acuity and that specific access to technology may not be readily available. So just disseminating accurate information to older adults seems to be an issue. So we had to be very creative with the way that information is passed on. Ultimately, in terms of just medical impact, it's clear as far as COVID-19 is concerned, but I will mention that right now, a lot of hospitals and medical providers are alerting the public to the impact that's not just COVID related in terms of complications and deaths, but also in terms of problems and chronic conditions that seniors may be living with every day. So ignoring symptoms, for instance, of a heart attack, ignoring symptoms of heart rhythm or stroke problems that typically seniors would seek help for in these institutions. But now, in light of COVID-19 or the potential for spread, and that being the most susceptible and vulnerable population, that is the medical sequelae that we're also dealing with and trying to get information out there. If seniors are experiencing critical medical symptoms, they should truly seek help, because the risk-benefit analysis of that is, regardless of the potential threat of COVID-19, you should still seek the help of a medical professional when you're experiencing an acute issue and an acute problem. And then finally, of course, the social isolation, which is a very, very important topic, especially given the fact that that technological acuity may not be present, where that social media platform that's readily available for everyone, and it seems as though the public at large was ready to convert to a virtual platform at the drop of a dime, that may not necessarily be a fact for our older adults, and that poses an issue in and of itself with social isolation and a vacuum of information of sorts also, because as the more susceptible and vulnerable population, we need to ensure that that information really penetrates the demographic that we're trying to reach.
And I think, the points you make are so valid. I mean, the fact is that, from the psychological perspective, we always talk about the connection between body and mind. And from the medical perspective, you talk about the perspective of body and mind. And one of the themes that we wanted to get out there clearly is that people do not have to do this alone, and the fact is that, there are supports out here. I'm not just saying this because three of you represent government, but not only do you represent government, but you represent government well. My friend and colleague, Jeff Kahana, we ended up getting an NIH grant about 9 years ago. So we traveled the country and looked at AAA networks and how government, integrated. And the three of you, have demonstrated how government can respond in a unified, and I like the fact that you said, rapidly, drop of the dime, rapidly you were able to respond. So there is something, there's testimony to that. We thought when we came into this that we didn't know where this was going to go. And then all of a sudden the applause started to say, do more of it. So we had set up 10 sessions, Now we're talking about, season 2, the next 10 sessions. And that will have a specific focus, on high risk veterans, nursing home residents, being able to get out to the nursing home administrators through this type of technology. Families that have children with family members with special needs. It's all unique, because your point, again, Dr. Gelman, is the fact that, how do you reach people that may not be, reachable through the social media thing? And that's where our strength comes in our mailing list and being able to get this material out. We've had one group contact us and ask us if they could use it as an in-service training. The answer is absolutely. Okay, that's the type of thing that we want to be able to do. So Anne-Marie, I know that, please.
Yeah, I was going to say, I think one of the things that makes this work is because of the way Orange County does business. We refer to our county executive as Steve. We don't do that to be disrespectful, but we do it because he's so connected. And if anything, you can text him at all hours of the day and night, and he's very passionate about it. This is not just a job for him. And Dr. Gelman is the same way. They are all on board. And when we talk about, the health and the psychological part, we know social determinants of health really go a long way to the success of someone's physical health. And so having this loneliness and isolation is an issue. We are doing friendly visitor calls. We are trying to do eyes on people with volunteers, although, it's it's a tough thing because we want the community to be healthy and safe, but yet we need to check on these folks. So education and awareness are key, and that's really what we're doing right now. And I think this is part of it. We're sending out flyers, we're sending out handouts to people that don't necessarily have access to a YouTube or a Zoom call, but we're hoping that their families do, so that then they can call them. But the most important thing really is to just keep that connection and don't lose the connection, because that's when things can start to happen.
And the other thing is that each of you have talked about your availability. Obviously, you're present here, but your availability, your offices are available and can be connected. And the thing that families and individuals need to know is that it's confidential. You know, when you bring in, adult protective services, it's a confidential conversation. So if you feel as though that you're in need, you have the availability to be able to reach out, to the different agencies.
Right.
So at this point, are there summary themes that you'd like to get out there? Steve?
I think just one quick thing, this is Orange County Executive Steve Neuhaus. I got to tell you, Anne Marie has done a phenomenal job wrangling everybody. And I said there's a lot of resources coming in and a lot of resources that need to get out. So, she's had to organize volunteers to handle. We had Meals on Wheels programs that completely collapsed. I got a phone call today from an organization in Southern Orange County that said, it's been 7 weeks. They can't do it anymore. Can we handle it? And there's no choice. There is no rung below Anne Marie and I and our county, operation. So she's done a phenomenal job. Dr. Gelman and I are on this every day and hearing the numbers and giving her the support she needs. But I mean, phenomenal stuff going on. It is a very uncharted territory as far as, what's happening right now. Our nursing homes where some of these people are getting sick and trying to keep people away from them. We've purchased iPhones for every patient in Valley View Nursing Home so that we could protect them from having outside people come in, because it's very tough to tell somebody, an adult, that they can't have a visitor. So I want to thank Anne Marie for all the support she's done, and all the volunteers as well, and our staff.
Thank you so much. I appreciate it.
Well deserved, because you have done a wonderful job. The three of you have done a wonderful job. And I think that, the thing you need to hear from us, Steve, is the fact that we so appreciate your continued support of this, because of the fact that we know that as this is moving forward, our reach is becoming wider and wider and wider. Mm-hmm. So at this point,
absolutely.
Yeah,
for sure. Alyssa?
Yeah, well, if that's all, Dr. Gilman, did you have any final things to say before we wrap up for today?
So I did want to echo what the county executive and Anne Marie Maglione have already mentioned in terms of communication being sort of the overarching theme here, whether that's virtual communication via the access and remote access platforms. As we all have seen and heard, I have been a tremendous proponent of virtual platforms. For anyone that knows me, I've been speaking about this for decades now. As a matter of fact, my dissertation and thesis actually centers on telehealth integration into the government sector. But in general, communication as a pattern, having the open lines of communication and really disseminating accurate, concise information. We have been fortunate in Orange County to have the steadfast leadership of our county executive. We know even his motto is nothing but the facts. And he really goes above and beyond to ensure that we're receiving accurate information and disseminating nothing but precise facts. And that's an important factor with integrating technology in order to continue that communication, because we have seen the devastating impact of COVID-19 on the senior population, even with wellness checks that some of them unfortunately actually culminate in a potential unattended death. So we definitely want to ensure that we're staying in touch remotely and integrating technology whenever possible to really facilitate that communication process and ensure ensure that everyone is obtaining accurate information. Isolation quarantine is sort of the side effect of any pandemic or outbreak scenario, and that in and of itself pretty much guarantees social isolation, especially for the older adults. Anne-Marie and I have coupled on a number of initiatives early on. I was very fortunate to have her support in reaching out to all the senior centers very early, and this predates even our first confirmed cases and confirmed numbers, to ensure that the most vulnerable and susceptible populations are protected and are receiving information earlier than anyone else. So that's truly a testament to that coordination and communication that we've all spoken about today.
Excellent. Well, thank you so much. And just to reiterate stuff that Anne-Marie Maglione spoke about and we've talked about in the past, if you do see something, the county and state agencies are here to reach out, for you to reach out to and to help. So it's better to say something than to let it go unsaid. So Anne-Marie, do you want to give us that number again? If someone
I'd like to give it more time. Our New York Connects, which is our single point of entry, 845-615-3710. If there is, you suspect some elder abuse, call Adult Protective Services, 845-291-2800. It can be anonymous. Always err on the side of caution. If you think it, just let us check it out. Best case is, everything is fine. But worst case, if you don't do something, it really can escalate.
Well, thank you again for joining us today. You've been listening to the Elder Abuse Awareness Virtual Coalition. If you want to hear this program again or share it with friends, even comment on it, you can do so by logging on to our website, www.elderabuseawarenessvirtualcoalition.com. You can also follow us on Facebook, Instagram, and YouTube. And make sure to sign up for our newsletter while you're on our website. We hope you can join us next week as we continue the conversation on elder abuse awareness. Thanks for being here.